Question 1. Based on the information from the National Council on Radiation Protection and Measurements (SRP), which of the following factors plays the most significant role in influencing the biological response to radiation exposure? A. Radiation type. B. Dose rate. C. Total dose. D. Duration of exposure. Answer. Correct answer. B. Dose rate. Explanation. The dose rate refers to the rate at which radiation is delivered to the tissue. High dose rates can lead to more immediate biological effects, as cells do not have sufficient time to repair the radiation-induced damage. The ALARA principle emphasizes minimizing the dose rate to reduce adverse biological effects. SRP report No. 116 highlights that dose rate is a critical factor, determining both stochastic and deterministic effects, influencing the severity of radiation damage to tissues. Question 2. During the process of designing a radiation therapy treatment plan, which mechanism of radiation interaction would be the most significant when considering photon radiation? A. Ionization. B. Pair production. C. Compton scattering. D. Photoelectric effect. Answer. Correct answer. C. Compton scattering. Explanation. Compton scattering is the primary mechanism by which photon radiation interacts with matter in therapeutic radiation doses, particularly at medium energies. In this process, the photon transfers part of its energy to an outer electron, causing ionization and scattering the photon. This interaction plays a crucial role in how energy is deposited within the tumor tissue. SRP report No. 130 focuses on the significant contribution of Compton scattering to dose distribution in therapeutic applications, which is critical for treatment planning. Question 3. In response to recent studies, it has been observed that radiation exposure can significantly impact DNA. Which of the following is the most likely result of double-strand DNA breaks caused by ionizing radiation? A. Immediate cell death. B. Mutation and cancer development. C. Repair and recovery without consequence. D. Enhanced immune response. Answer. Correct answer. B. Mutation and cancer development. Explanation. Double-strand breaks in ENA are one of the most lethal types of damage caused by ionizing radiation. These breaks are difficult for the cell to repair accurately, and when misrepaired, they can lead to mutations, which may ultimately result in cancer. SRP report No. 136 highlights the connection between ENA damage and carcinogenesis, emphasizing the stochastic effects of radiation, where even small doses of ionizing radiation can increase the likelihood of cancer development due to genetic mutations. Question 4. Considering the evidence for SRP reports, which of the following is most effective in reducing external radiation exposure during medical procedures involving ionizing radiation? A. Increased exposure time. B. Using higher energy radiation. C. Shielding with lead. D. Prolonging patient positioning. Answer. Correct answer. C. Shielding with lead. Explanation. Shielding with lead is one of the most effective ways to protect patients and healthcare workers from external radiation exposure. Lead is highly effective at attenuating X-rays and gamma radiation, which are commonly used in medical diagnostics and treatments. The SRP report No. 147 recommends lead shielding for personnel and patients during procedures involving high radiation to minimize exposure. Shielding helps to ensure radiation safety by reducing the scattering and transmission of ionizing radiation. Question 5. In the context of radiation protection, Mr. Thompson works in a nuclear power plant and has been exposed to radiation over an extended period. What is the primary objective when considering Mr. Thompson's exposure history? A. To determine if the exposure has caused any deterministic effects. B. To calculate the total amount of radiation he received. C. To evaluate if his exposure is within the occupational dose limits. D. To assess the possibility of a legal claim for damages. Answer. Correct answer. C. To evaluate if his exposure is within the occupational dose limits. Explanation. The primary goal is to ensure that Mr. Thompson's radiation exposure remains within the established occupational dose limits. The SRP report No. 116 provides dose limits for radiation workers, aiming to prevent both deterministic and stochastic health effects. The evaluation considers factors such as the cumulative received, which should not exceed the recommended limits for the prevention of radiation-induced illnesses, including cancer. The legal aspects are secondary to ensuring compliance with safety regulations. Question 6. What would happen if a radiation source were to be exposed to environmental factors, such as increased temperature, leading to an increase in radioactive decay? A. The decay rate would decrease. B. The decay rate would remain constant. C. The decay rate would increase. D. The decay rate would become erratic. Answer. Correct answer. B. The decay rate would remain constant. Explanation. Radioactive decay is a random process that occurs at a characteristic rate specific to each isotope. This process is governed by the half-life of the material and is unaffected by environmental factors such as temperature. SRP report note 160 emphasizes that the decay rate is intrinsic to the material and cannot be accelerated or slowed by external conditions like temperature or pressure. This is a fundamental aspect of radioactive materials in radiation safety. Question 7. Considering the implication of SRP guidelines, which of the following best describes the role of the ALARA principle in radiation safety? A. It is a rule that mandates strict dose limits without exceptions. B. It involves minimizing radiation exposure to as low as reasonably achievable, considering economic and social factors. C. Applies only to occupational radiation exposure, not to patients or the public. D. That suggests that radiation exposure is only safe if the benefits outweigh the risks. Answer. Correct answer. B. It involves minimizing radiation exposure to as low as reasonably achievable, considering economic and social factors. Explanation. The ALARA, as low as reasonably achievable, principle is a key concept in radiation protection, which is emphasized in an RP report note 116. The goal is to minimize radiation exposure by using all reasonable precautions to keep doses low while balancing factors such as cost, time, and social considerations. It applies to both occupational exposures and public exposure, ensuring that radiation risks are reduced to acceptable levels without compromising essential processes. Question 8. In what way does linear energy transfer LET impact the biological effectiveness of radiation? A. Higher LET results in low biological damage. B. Lower LET increases the probability of cancer. C. Higher LET results in higher biological damage. D. LET has no effect on biological damage. Answer. Correct answer. C. Higher LET results in higher biological damage. Explanation. Linear energy transfer, LET, refers to the amount of energy deposited by a particle per unit of distance traveled through a medium. Higher LET radiation, e.g. alpha particles, causes more localized damage to tissues, leading to greater biological effects, including DNA breaks and potential carcinogenesis. SRP report no. 131 discusses the role of LET in radiation protection, emphasizing that high LET radiation is more biologically effective even at low doses compared to low LET radiation like X-rays and gamma rays. Question 9. As illustrated by research, which of the following dose-response relationships is most commonly associated with radiation-induced cancer? A. Linear no threshold. B. Nonlinear threshold. C. Linear threshold. D. Nonlinear no threshold. Answer. Correct answer. A linear no threshold. Explanation. Radiation-induced cancer is typically associated with a linear no threshold dose-response relationship. This means that even small doses of radiation have a proportional increase in the risk of cancer with no safe lower limit. The SRP report note 132 highlights that cancer risks from ionizing radiation follow this model, where the likelihood of developing cancer increases as radiation dose increases without a threshold below which the risk is zero. Question 10. Given the circumstances of radiation safety, how might one explain the effectiveness of using neutron detectors in radiation surveys? A. Neutron detectors are ineffective and not commonly used in radiation protection. B. Neutron detectors are most effective in detecting low-energy gamma radiation. C. Neutron detectors are used to measure neutrons emitted by certain radioactive materials or nuclear reactors. D. Neutron detectors are used to measure only alpha particles. Answer. Correct answer. C. Neutron detectors are used to measure neutrons emitted by certain radioactive materials or nuclear reactors. Explanation. Neutron detectors are essential for measuring neutron radiation, which is commonly found in nuclear reactors, particle accelerators, and certain industrial applications. Neutrons are more penetrating than alpha or beta particles, and specialized detectors are required to accurately measure neutron flusses. Report No. 140 discusses the need for proper neutron detection in areas with potential radiation exposure from such sources, emphasizing the importance of accurate measurements for ensuring safety. Question 11. Given the circumstances Dr. Williams is working in, a medical radiation therapy setting where the patient is being treated with high-energy photons, the patient is exposed to a high dose in a short period of time. Which of the following factors will most influence the likelihood of deterministic effects, such as skin erythema, occurring in this scenario? A. High linear energy transfer of the radiation. B. The radiation dose rate. C. The oxygen effect. D. The type of photon energy used. Answer. Correct answer. B. The radiation dose rate. Explanation. Deterministic effects like skin erythema are more likely to occur at higher doses delivered in a short time high dose rate. The dose rate directly influences the severity of such effects, as tissues have less time to repair between radiation exposures. The oxygen effect, C, typically applies to stochastic effects rather than deterministic ones, while high let A may affect the severe biological damage but does not directly influence deterministic effects in this context. The type of photon energy, D, impacts the dose distribution but not the immediate occurrence of deterministic effects. Question 12. To what extent does the concept of ALARA, as low as reasonably achievable, guide the optimization of radiation protection practices in industrial radiation applications? A. ALARA primarily applies only in medical settings and not in industrial applications. B. ALARA requires that radiation protection be optimized for each situation to minimize unnecessary exposure. C. ALARA only applies to occupational exposures and not to the general public. D. ALARA emphasizes the need for using only protective clothing without regard to other factors. Answer. Correct answer. B. ALARA requires that radiation protection be optimized for each situation to minimize unnecessary exposure. Explanation. The ALARA principle is central to all radiation protection strategies, including both medical and industrial settings. It mandates the optimization of radiation protection by minimizing exposure to radiation while still achieving the intended result. It is not limited to occupational settings. C. It involves multiple strategies beyond just protective clothing. D. Including time, distance, and shielding. Option is incorrect because ALARA is universally applicable in radiation protection. Question 13. In the context of radiation safety, what would be the most appropriate action for a radiological technician who discovers that a sealed radioactive source has begun to show signs of leakage during storage? A. Secure the area and immediately evacuate all personnel from the vicinity. B. Immediately continue working with the source wearing standard protective clothing. C. Notify the radiation safety officer and follow the decontamination procedures outlined. D. Dispose of the source in the nearest waste container and report the incident later. Answer. Correct answer. C. Notify the radiation safety officer and follow the decontamination procedures outlined. Explanation. In case of leakage of a sealed radioactive source, the technician must immediately notify the radiation safety officer (RSO) to follow proper containment and decontamination procedures, which are outlined in radiation safety protocols. Evacuation may be necessary, depending on the scale of the leak, but the step is notifying the RO. Continuing to work without addressing the leak. B. Violates safety protocols and improper disposal. D. Could result in exposure or contamination. Question 14. From the perspective of radiation biology, which of the following best describes the principle behind the repair of DNA damage caused by ionizing radiation? A. The DNA damage is always irreversible, and cells cannot repair themselves. B. DNA repair mechanisms work in tandem with the dose rate to ensure no genetic mutations occur. C. Cells repair DNA damage based on the type of radiation, with X-rays being the easiest to repair. D. Cells possess repair mechanisms that can fix radiation-induced damage, but the effectiveness depends on factors such as dose and the cell cycle. Answer. Correct answer. D. Cells possess repair mechanisms that can fix radiation-induced damage, but the effectiveness depends on factors such as dose and the cell cycle. Explanation. DNA repair mechanisms are crucial in mitigating radiation-induced damage, but their efficiency varies with the radiation dose, type, and the phase of the cell cycle. High doses can overwhelm the repair mechanisms, while certain stages of the cell cycle are more sensitive. Radiation damage. The notion that DNA damage is always irreversible is incorrect, as cells can repair a significant amount of damage. Repair is also not solely dependent on radiation type. C. And the repair efficiency is not purely dependent on the dose rate. B. Question 15. What factors contribute to the effectiveness of a shielding material used in radiation protection? A. Only the atomic number of the material matters, with no regard for density. B. The effectiveness depends on both the atomic number and the density of the material, as these influence the material's ability to interact with radiation. C. The material's effectiveness is based purely on its thickness. D. Shielding effectiveness depends entirely on the type of radiation and not on the material used. Answer. Correct answer. B. The effectiveness depends on both the atomic number and the density of the material, as these influence the material's ability to interact with radiation. Explanation. The shielding material's ability to attenuate radiation depends on both its atomic number, Z, and density. Higher atomic numbers lead to greater attenuation, particularly for photon radiation. Dense materials are better at reducing radiation penetration due to higher mass and interaction probabilities. The thickness of the material, C, is important but not the sole factor. Shielding effectiveness does depend on the type of radiation. D, but material properties such as Z and density play a key role. Question 16. In a medical radiation therapy setting, what is the primary factor influencing the probability of a radiation-induced stochastic effect, such as cancer? A, the total dose of radiation received by the patient. B, the energy level of the radiation used in the treatment. C, the oxygen enhancement ratio of the patient's tissue. D, the fractionation of the radiation dose. Answer. Correct answer. A, the total dose of radiation received by the patient. Explanation. Stochastic effects like cancer are primarily influenced by the total radiation dose and the probability of the effect occurring rather than its severity. These effects do not have a threshold dose, so even small amounts of radiation can increase the risk. Energy level, B, C, and fractionation, D, may impact tissue responses or treatment outcomes but do not directly correlate to the likelihood of stochastic effects like cancer. Thus, the total dose is the most important factor. Question 17. The impact of radiation exposure on a biological system is influenced by which of the following variables? A, the rate of tissue turnover in the affected area. B, the age and health of the individual at the time of exposure. C, the phase of the cell cycle when the exposure occurs. D, all of the above. Answer. Correct answer. D, all of the above. Explanation. Radiation effects on biological systems depend on multiple factors, including the rate of tissue turnover, A, the age and health of the individual, B, and the cell cycle phase, C. Tissues with high turnover rates like bone, marrow are more sensitive to radiation. Younger individuals may have more rapidly dividing cells that are more susceptible, and cells are most vulnerable to radiation. Certain phases of the cell cycle, therefore all these factors influence the radiation response. Question 18. During the process of evaluating the effectiveness of radiation shielding, which of the following is most critical when choosing between different materials? A, the cost of the material regardless of its properties. B, the type and energy of the radiation being shielded. C, the appearance and texture of the material. D, the weight of the shielding material. Answer. Correct answer. B. The type and energy of the radiation being shielded. Explanation: the type of radiation, alpha, beta, gamma, neutrons, and its energy level are the most critical factors in determining which shielding material to use. For example, lead is effective against gamma radiation, but not against neutrons, where materials like boron or polyethylene are better suited, while cost, appearance, C, and weight D may be factors. Primary consideration should be the radiation type and energy. Question 19. When considering contamination control procedures in a radiation environment, what is the most effective method for preventing the spread of radioactive material? A. Using air filters and ventilation systems to contain airborne particles. B. Using water-based decontaminants to wash down contaminated surfaces. C. Restricting access to contaminated areas and employing personal protective equipment (PPE). D. Relying on personal monitoring devices to detect contamination. Answer. Correct answer. C. Restricting access to contaminated areas and employing personal protective equipment (PPE). Explanation: the most effective way to prevent the spread of radioactive contamination is to limit access to contaminated areas and ensure proper use of personal protective equipment (PPE), such as gloves, gowns, and masks. This minimizes the risk of contamination on personnel and equipment. Air filters, A, and decontaminants, B, are important secondary measures but do not replace restricting access. Personal monitoring, D, detects contamination but does not prevent its spread. Question 20. In light of recent developments in radiation safety, which of the following practices should be prioritized for radiation protection in research applications? A. Minimizing exposure to radioactive sources, even if it means sacrificing experimental precision. B. Ensuring that the radiation dose to researchers does not exceed any recommended limits, regardless of the research goals. C. Maximizing radiation dose to achieve the desired experimental results. D. Using radiation sources without shielding as long as the researchers are monitored regularly. Answer. Correct answer. B. Ensuring that the radiation dose to researchers does not exceed any recommended limits, regardless of the research goals. Explanation: radiation protection in research applications should prioritize minimizing exposure and ensuring that doses remain within recommended limits set by agencies like the CERP. This approach balances the need for scientific progress with the health and safety of personnel. Excessive radiation exposure and unshielded sources D. violates safety guidelines. While precision is important, A, it should not come at the expense of exceeding safe dose limits. Question 21. Which of the following methods is most effective in reducing radiation exposure during fluoroscopic procedures? A. Reducing the fluoroscopy time and using pulsed fluoroscopy. B. Increasing the distance between the radiation source and the patient. C. Using lower energy radiation and higher doses. D. Adding additional shielding to the imaging equipment. Answer. Correct answer A. Reducing the fluoroscopy time and using pulsed fluoroscopy. Explanation: reducing fluoroscopy time and using pulsed fluoroscopy are key strategies in minimizing radiation exposure during procedures. These techniques limit the duration of exposure and use intermittent radiation, thereby reducing the total dose. Increasing distance B can also help, but the most effective approach is reducing exposure time. Lower energy radiation C and higher doses would actually increase exposure, and additional shielding D may not always be feasible or the most effective option in fluoroscopy. Question 22. What is the primary reason for the use of lead aprons in radiologic procedures? A. To increase the overall image quality by absorbing excess radiation. B. To protect the radiation source from contamination. C. To shield the operator from scattered radiation. D. To prevent radiation from reaching the target tissue. Answer. Correct answer. C. To shield the operator from scattered radiation. Explanation: lead aprons are designed to protect the operator and other personnel from scattered radiation, which is the radiation that bounces off the patient or equipment. Lead effectively absorbs and attenuates this scattered radiation, reducing occupational exposure. The use of lead aprons does not directly impact image quality A or protect the radiation source B. Radiation from reaching target tissue D is more relevant for patient protection rather than operator protection. Question 23. In the event of a radiation emergency in a hospital, which of the following actions should be prioritized for personnel safety? A. Monitoring radiation exposure levels using personal dosimeters. B. Evacuating the area immediately and awaiting instructions from authorities. C. Using full body shielding to block all radiation exposure. D. Disinfecting the affected areas with water to reduce contamination. Answer. Correct answer. B. Evacuating the area immediately and awaiting instructions from authorities. Explanation. In a radiation emergency, the first priority is to evacuate personnel from the affected area to minimize exposure. Monitoring radiation exposure is important, but evacuation ensures safety first. Full body shielding C is not always feasible or effective in an emergency scenario, and disinfecting areas D is secondary to personnel to safety. Question 24. Which of the following is the most critical factor in determining the potential for biological damage when ionizing radiation interacts with human tissue? A. The total dose of radiation delivered to the tissue. B. The energy level of the radiation and its penetration ability. C. The type of radiation and its linear energy transfer. D. The amount of time the radiation source is active. Answer. Correct answer. C. The type of radiation and its linear energy transfer. Explanation. The type of radiation and its critical factors in determining biological damage. High-let radiation, such as alpha particles, tends to cause more damage to tissues than low-let radiation, such as gamma rays, even at the same dose, while total dose A and energy level B also influence biological effects. The is the most significant. Is context. Time D can affect exposure but does not directly determine biological damage potential. Question 25. Which of the following best describes the role of the National Council on Radiation Protection and Measurements (SRP)? A. The SRP sets legal radiation dose limits for radiation workers and the general public. B. The SRP provides recommendations and guidelines to minimize radiation exposure but does not have regulatory authority. C. The SRP oversees the licensing and certification of radiation workers. D. The SRP conducts independent research on radiation-induced health effects. Answer. Correct answer. B. The SRP provides recommendations and guidelines to minimize radiation exposure but does not have regulatory authority. Explanation. The SRP provides recommendations and guidelines on radiation protection and safety, but it does not have regulatory authority. Regulatory agencies such as the EPA and NRC enforce radiation safety standards. The SRP does not issue licenses or certifications. C. Does it conduct independent health research? D. Its focus is on establishing safety recommendations. Question 26. In radiological protection, what is the most important consideration when using a mobile X-ray unit in a hospital room? A. Ensuring the radiation dose is higher to improve image quality. B. Maintaining a safe distance from the radiation source to reduce exposure. C. Using an increased exposure time to allow better image resolution. D. Positioning the X-ray tube as close as possible to the patient to reduce scatter. Answer. Correct answer. B. Maintaining a safe distance from the radiation source to reduce exposure. Explanation. The most effective way to reduce radiation exposure is to increase the distance between the operator and the radiation source. This is in accordance with the inverse square law, which states that radiation exposure decreases with the square of the distance from the source. Increasing exposure time, C, or dose A, would increase radiation, and positioning the tube close to the patient could increase scatter radiation, D. Question 27. Which of the following best describes the purpose of the dose-response curve in radiation protection? A. To predict the severity of radiation-induced effects based on the dose received. B. To determine the precise amount of radiation a person can safely receive. C. To measure the effectiveness of radiation shielding materials. D. To illustrate how radiation damage to cells can be repaired over time. Answer. Correct answer. A. To predict the severity of radiation-induced effects based on the dose received. Explanation. The dose-response curve is used to predict the severity of radiation effects based on the dose received. It helps radiation protection experts assess the risk and potential biological impact of different levels of exposure. It does not directly measure the effectiveness of shielding, C, or illustrate repair mechanisms, D, nor is it used to safe dose limits, B. Question 20. When assessing the potential risk of radiation exposure to a pregnant patient undergoing imaging, which of the following should be prioritized? A. Reducing the total dose by optimizing imaging parameters and technique. B. Ensuring that the patient receives the minimum possible dose, regardless of image quality. C. Using higher energy radiation to minimize exposure to the fetus. D. Avoiding imaging altogether, as radiation exposure is always harmful during pregnancy. Answer. Correct answer A. Reducing the total dose by optimizing imaging parameters and technique. Explanation. The primary goal when imaging a pregnant patient is to reduce radiation exposure to the fetus while still achieving the necessary diagnostic results. Optimizing imaging parameters such as exposure time and technique helps minimize the total dose. Avoiding imaging altogether, D, may not always be necessary or advisable if the imaging is medically justified. Higher energy radiation, C, does not necessarily reduce fetal risk. The balance between dose and image quality, B, is key. Question 29. What is the key principle behind the concept of radiation protection for the general public? A. Public exposure should be maintained at the same levels as occupational exposure. B. Public exposure should be minimized and should never exceed recommended dose limits. C. Public exposure can be higher than occupational exposure if necessary for medical procedures. D. Public exposure can be justified by economic benefits as long as it does not exceed 50% of the occupational dose. Answer. Correct answer. B. Public exposure should be minimized and should never exceed recommended dose limits. Explanation. The principle of radiation protection for the general public is to minimize exposure and ensure it never exceeds the recommended dose limits set by organizations such as the SRP. Public exposure should be as low as reasonably achievable and should always be lower than occupational exposure limits. Economic benefits do not justify higher public exposure, D, and medical procedures should always be justified and optimized, C. Question 30. Which of the following is the most effective way to ensure that radiation exposure to a radiologic technologist is minimized during a procedure? A. Using the shortest exposure time possible while still obtaining adequate diagnostic images. B. Wearing lead shielding to block all radiation. C. Monitoring the technologist's exposure levels with a dosimeter without modifying procedures. D. Avoiding patient positioning and relying on automated systems to control exposure. Answer. Correct answer A. Using the shortest exposure time possible while still obtaining adequate diagnostic images. Explanation. The most effective way to minimize radiation exposure to the technologist is by using the shortest exposure time that still provides high-quality diagnostic images. Lead shielding, B, can reduce exposure but does not eliminate all risk. Monitoring exposure with a dosimeter, C, is important but does not directly exposure. Relying entirely on automated systems, D, may not optimize the radiation dose for each specific procedure.